Hello and welcome everyone to yet another episode of USTM PODCAST. I am your host Rajashree, and today we will be having an insightful discussion on minimally invasive surgeries or laparoscopic surgeries. We have with us as guest Dr. Nishad Kumar Deka, Assistant Professor, Department of Surgery, PA Sangma International Medical College and Hospital, Meghalaya. Welcome Dr. Deka.
Thank you Rajashree for calling me here.
So to start things off, if you could tell our listeners what are minimally invasive surgeries or laparoscopic surgeries?
Minimally invasive surgery or laparoscopic surgery in common term known as keyhole surgery. As like keyhole surgery, the name implies that we put very small incision in those surgeries. There are multiple incisions, of course, but compared to conventional surgeries, we put 3 or 4 small incisions. We use small instruments, and there are very less stitches.
So doctor, if you could tell us what are the benefits of laparoscopic surgery or minimally invasive surgery, or why should one opt for those surgeries instead of a open surgery?
The main benefits of laparoscopic surgery is that the morbidity of the patient is very less compared to conventional surgery.
Right.
Here there is very less hospital stay, there is very less tissue morbidity, like very less blood loss. I have said less hospital stay. I have already said. Then we use very high sophisticated instruments, so we can very closely monitor the organs and do the operation. And said so, the chances of complications are very less in laparoscopic surgery. Injury to the main organs or like that is very less in laparoscopic surgery. And there is of course, cosmetically it is very good. There is scars are very less. So we prefer laparoscopic surgery than open surgery. In open surgery, we have to open up and see. So hospital stays are more. There is more pain. In laparoscopic surgery, the pain is very less. People used to mobilize from the next day only. So in conventional surgery, it's sometimes in big surgery, it takes 2 to 3 days to mobilize the patient. So in laparoscopic surgery, those are the main benefits. Less hospital stay, early mobility, less infections, chance of infections are less as the scars are small. So those are the benefits. That's why we prefer laparoscopic surgery.
Right. So Dr. Deka, as we have spoken about the benefits of these surgeries, so I would want to know if there are any risks involved in these surgeries?
Yes, Rajashree, there are some risks associated with laparoscopic surgery. Those serious problems are very uncommon. Every surgeries have some risks. Sometimes, as in laparoscopic surgery, in initial state of a surgeon, the chances of complication or risks may be there, or during the procedure in the operation in initial stages, like doing the various needle insertion, some risks are there. Otherwise, they are very uncommon. There are very less risks involved.
Okay. So Dr. Deka, what are the common procedures or surgeries that are done through laparoscopic process?
There are lots of surgeries we done under we do in laparoscopic surgery. In Department of Surgery, we do laparoscopic cholecystectomy, that is removal of gallbladder when there is stones, of course other infected gallbladder like that, or laparoscopic appendicectomy we do, then laparoscopic hernia repair. There are other higher range of surgeries like lap hemicolectomy can be done in cancer cases or in obstructions. So, and sometimes laparoscopic surgeries are used as an assistance, like we do half of the surgery in laparoscopic surgeries, and after doing half of the part, we make a small incision, not like laparoscopic surgery, but compared to conventional surgery, a small incision through which we can take out the organ and we do the surgery. But it is called as laparoscopic assisted surgery. That is also a part of minimally invasive surgery or laparoscopic surgery. Those are the main surgeries in surgical department. But as such, minimally invasive surgeries, gynecological department have other departments are also using laparoscopic surgery. Like in gynecological department, they are doing total laparoscopic hysterectomy, laparoscopic ovarian cystectomy, laparoscopic salpingectomy for ectopic pregnancy and like that. So nowadays laparoscopic surgery is used in emergency surgeries also. Orthopedic surgeons are using in like spine surgeries and arthroscopy. CTVS surgeons are using in thoracoscopy. So these are that is called as VATS, video assisted thoracostomy. Like that, it is very upcoming, and every department is taking up the minimally invasive surgery procedures because of its benefits, as I have said earlier.
So, Dr. Deka, what are the challenges that you might have faced in minimally invasive surgeries?
The main challenges of laparoscopic surgery is that the learning curve is more. It takes a surgeon to give some time to learn the art of doing laparoscopic surgery. And as I have said earlier, that we use very small instrument compared to open surgery. In open surgery, we deal with the organ directly. In minimally invasive surgery, actually there is a scope which we insert into the abdomen or the area where we are going to operate. It has a telescope, it has a camera, and it has a light source, so through which we see the organ inside. We have some operating instruments which are very small, which are delicate to handle, we should learn. And compared to this open surgery, we don't have the tactile sensation, so we have to learn with the art. So main challenges is that to cope up with those instruments and then to do the surgery, of course. So we need it's a high learning curve. It takes some years to learn and to expertise the art of surgery. And moreover, in some hospitals, we have instruments are also equipments. Some for some maneuvers, some other like operation, like as such CBD exploration and all, we need 2 camera systems. We need extra instrument for that. So some hospitals are lagging behind that thing, but USTM is having all those things. So we are doing laparoscopic surgery here. So as such, we are also improving.
So, Dr. Deka, what are the surgeries that the Department of Surgery has taken up in PIMC?
Till now, we have done laparoscopic cholecystectomy, number of cases, laparoscopic appendicectomy, hernia repair, open hernia repair we have done, not laparoscopic hernia repair till now. We have not started that thing, but we are planning to do. And most common is laparoscopic cholecystectomy.
Okay.
In PIMC right now.
Okay, so since you've mentioned before also that laparoscopic cholecystectomy, or in layman language gallbladder stone operation, it is one of the most common surgeries.
Yes.
So if you could tell us how the procedure is done.
Yeah, it is very common in this part of India, means north and eastern part of India, where many people are having gallstone, and it is the incidence rate is very high, and we advise people to do removal of gallbladder for those gallbladder stone patient, or
Right.
cholelithiasis, what in medical term we call it cholelithiasis. Or sometimes if patient don't operate it earlier, we call it as and repeated pain or problem occurs, then it turns into a chronic calculus cholecystitis, what we term. So we advise the patient to go for laparoscopic cholecystectomy, and most of the surgeries we do here is laparoscopic cholecystectomy.
Okay, thank you.
So Rajashree, as you are asking about a procedure mainly for laparoscopic cholecystectomy, in the procedure is like that, the patient has to be under general anesthesia first. So the patient will not knowing what we are doing to him or her. So many people ask about whether they will be knowing or not. So in this laparoscopic surgery is a major surgery, and it is done under general anesthesia. Then after that, what we used to do in laparoscopic cholecystectomy, we need 4 port. Means we do 4 incision, small incision, 2 10 mm port we apply. That is less than 1 centimeter or equivalent to 1 centimeter 2 port, and 2 assistant port, it's equivalent to 5 mm. So through 1 port we insert our video endoscope, that the camera system, through which we will be seeing the gallbladder and the operating field. And 1 10 mm port for the surgeon and 1 5 mm port for the assistant, which will be holding the gallbladder and assisting the surgeon. So 2 port for the operating surgeon and 1 port for the cameraman and 1 port for the assistant, and like that we do the surgery. And so the 5 mm port are very small port actually, so that's why, as I have earlier said also, So it's very less morbid thing, and the stay is also very less. So the rest you have to see to how the procedure is done, and I think people will not. But what people wants to know is that how many ports, or like how much incision will be there, how much bigger incision. So it is very less, very minimal incision. 1 centimeter is very small size actually. So rest how we'll do the procedure is little bit different to explain here out here.
So, doctor, you've mentioned that the hospital stay is less in minimally invasive or laparoscopic surgeries. So, to be precise, how long is the stay exactly?
Now for the laparoscopic cholecystectomy, as I was saying, we ask the patient to get admitted 1 day before, or sometimes in the day of surgery also. We operate on that day, and on the next day, if everything goes well, we discharge the patient. So, and even in some hospitals, not in PIMC, daycare surgeries can be also done. Means a patient can be operated in the morning and can be discharged in the evening. I have done so in some hospitals, but here we discharge the patient in next day. So 2 days. 2 days. You can consider 2 days. That means 1 night stay and 2 days.
Okay, so that way it is very beneficial for the people. They can leave early.
Yeah, and it's okay. People can start work from 7 days or 8 days. People can start his work means.
Okay, so they can resume their office or whatever work they do.
Yeah, of course. But yeah, I ask the patient not to go for strenuous exercise or like hard work.
Okay.
But normal day-to-day life work can be done. It's no issue with normal work.
Okay. So, doctor, you have mentioned that laparoscopic cholecystectomy is a major surgery, right?
Yeah, major surgery. As I have said, any surgery which is done under general anesthesia or spinal anesthesia is considered as a major surgery. But the minor surgeries are those operations which are done under local anesthesia.
Okay. So, are there any risks involved in laparoscopic cholecystectomy?
As I have said, it is a major surgery. It doesn't mean that it is a high risk procedure.
Okay.
It's a major surgery because it is done under general anesthesia, but risk involvement or as such high risk we don't consider this as a high risk operation.
So, as we are discussing about the risks involved, so is there any chance of blood loss in laparoscopic cholecystectomy?
Chance of blood loss is very less. If we explain to the patient, sometimes in very good case we say the blood loss is nil, and that's the advantage of minimally invasive surgery or laparoscopic surgery. In open, we used to cut down the muscle. During cutting down or the bigger incision, in that incision also we have some blood loss. But in this small incision, blood loss is very minimal, and that's why we don't require any blood also during operation. Sometimes if some complication occurs, there is a blood loss is there, intraoperative blood loss is there, then some patient may require blood. But as such, normal elective surgery, we don't require blood in this laparoscopic cholecystectomy.
Okay. So, as a surgeon, I'm pretty sure you might be getting a lot of queries from or questions from the attendants, the family members, the patients also.
Yeah, patient, we got lot of questions like whether blood will be required, and the most the frequent question what we face, whether the patient operation will be successful or like that. So in terms of, or whether the stone will be left behind, like so there is no question of stone left behind in lap cholecystectomy because we take out whole the gallbladder entirely.
Okay.
It's not that we'll just open up the gallbladder and we'll take out the stones. We'll take out the whole gallbladder. The stones will be in a bag of like if we take out stones in a bag, every stones will come out like that. If we take out the gallbladder, so there will no chance of any stone left behind. So most of the patient asks, or the mainly attendant asks, whether there will be any stone will be left out in laparoscopic surgery because we will be seeing through small holes.
Right.
Actually, the concept is not like that. The concept is that through small holes we put a camera system. We used to do the operation by seeing a monitor, so there is no chance of any stone or anything left behind. So That is the most frequent question. Then, as you have uttered about blood loss, people ask whether blood will be required, whether they have to keep a blood in a blood bank. So those things are not required in laparoscopic surgery.
Okay. So what are the complications that one might face in a laparoscopic cholecystectomy procedure?
So, as you have asked directly about the complication related to laparoscopic cholecystectomy, during operation, one may injure the organ sometimes accidentally, like liver may be injured. Rare, very rare. Sometimes during pneumoperitoneum, when we go insert the abdomen in the first port, insertion only, we may do perforation in gut or like that. And the major complications, as you have directly asked me, during operation, we may injure the common bile duct system, and which is it's a major complication which we rarely see in gallbladder surgery.
So since we have discussed so many things, any take-home message for our listeners?
So take home message will be like, if I will ask the patient or the people if they are detected with any disease which their surgeon, or which if they have come to PIMC, if we have advised for operation, they should go for the operation without any afraid, or they should not afraid of doing the operation, because nowadays those commonly done procedures are, as I have told, is very less risky, less morbid, and even in PIMC the main financial part, we have to say, it is very minimal. I can say that, I can assure the people that the financial part is very minimal we are taking here, so they can come to PIMC, they can uh, go for the operation. And if they delay it, every disease has some complications of not doing the operation, because a physician or a surgeon would not prescribe or not advise a surgery unnecessarily. Like if you delay the gallstone also, as we have today podcast, we have discussed thoroughly about laparoscopic they might turn into cancer also. So we should not delay it for long. Then in appendicectomy have his own complications if delayed. So I would ask people to come and have the opportunities or avail the facilities which we are providing here.
So as you have said, the surgery should not be delayed and people should go as prescribed by the doctor, or advised by the doctor. So I'm sure our viewers have benefited from the discussion that we've had today.
Hope so.
So thank you so much, doctor, for being here with us today. Thank you so much.
Thank you for calling me.
Thank you, viewers, for watching USTM podcast, and do not forget to subscribe to our YouTube channel USTM Voice. Thank you and take care.